And welcome back. It's time for a Sunday Live interview. And joining me is Dr. Mercy Korir. She is the Deputy National Secretary of the Kenya Medical Practitioners Pharmacists, I beg your pardon, and Dentists Union. And I've been having a problem with my tongue all day today. But anyway, good to have you in studio.
Thank you, Anne, for
How about
having me.
we start off the back of that story? Is that incredible stamina for an 81-year-old?
Definitely is. I think I should start immediately for my age so that I could bridge that gap. By the time I'm 81, I should be at Everest.
I know, right? We all must. But he's in great shape, not so much the country's health sector. And of course, we have a strike that is on in at least 8 counties right now. I want you to start by giving us your perspective of what ails the health sector in the country.
Okay. As I said, thank you for having me here to represent the doctors. The problem with the health sector has been there previously, even before devolution. But I think our problems got magnified with devolution, because not so much as to the devolution itself, but I think it was an avenue to bring out what the problems in the health sector were. And when devolution happened in 2013, as a medical fraternity, we felt that it was devolving health was ill-timed at the time, that we needed more time to set up structures and, you know, have things in place for devolution to happen. But then again, we have to move. We cannot always sit in boardrooms and make papers and whatnot. We have to move. So now where we are, the major problem is in the human resource for health. That is where the major problem with devolving healthcare is, and not as much as we do not want to be devolved, but how the implementation and the management of the healthcare is. We had simple problems from as the national government releasing fast to the county government, so that the county governments can actually know who are the healthcare workers they have, at what job groups they are, what do they need to have so that they move on. So that delay from 2013, the files were released this year in May to the county government. So that tells you in a span of 2 years, what were the county governments doing? So we between the national and the counties, as doctors, you go to the national government, they tell you health is a devolved function, your problems are with the county government. You go to the county governments, they actually do not have the personnel files for them to actually get things moving.
And in your opinion, where does the dishonesty lie? Is it with the national government or is it with counties?
It is hard to tell, because with each arm, they have their facts. You go to the other one, they have their facts. So it's really hard to tell. But as what I would think is, health is a fully devolved function. Let the counties own up to their function and let them implement things as they're supposed to be implemented. Right.
There are various things that you're saying that sound like a slight departure from the position that KMPDU has taken, including your seeming appreciation of health as a devolved function. Let me ask you this. Do you agree with KMPDU's stance, which has been that health should not be devolved, that these services must be returned to the national government, because there has, counties have basically failed to be able to take on that role?
I think we are well past the question of asking should it be devolved or not. The Constitution 2010, the 4th schedule, health is a fully devolved function.
And yet, when you go to to press conferences, this is what the union says.
I think let's stick to what is legal, what is the law. The Constitution devolved health. So the question of whether we should devolve it or not is something totally different. We'll probably need a constitutional amendment. We'll probably need a referendum. But while we are doing that bit, the people on the ground are suffering. Services will not be delivered. Healthcare workers themselves will be suffering, because once there is fracas as it is now, your salaries are delayed, you're not paid. You are human. You need to pay your bills. Your children need to go to school. Maybe you yourself are in school. Things get delayed. So where we are now with the devolved function, can we make it work? Whether the national government is the one that will make the human resource work, or the county government is not the question here. We know where the problems are. We know what can be sorted. Can it be sorted by the right persons who are supposed to implement
How do
it?
strikes help you get closer to that end goal? Because it seems to many Kenyans, and nobody can argue, obviously, health workers must be paid for those services, absolutely. But it seems that you're punishing the wrong person.
The strikes, at least what the strikes give us is the audience with the relevant people. Let me give you an example of how we have at least managed to achieve something. The intern doctors, after finishing the internship, ought to be posted to facilities as now fully medical officers. Now we sat down with the Council of Governors, with the Ministry of Health and the Transitional Authority, and formed a committee which will now get all the qualified interns in this committee, distribute them equitably across all the counties so that they can be absorbed immediately into the relevant job group, which is M, and they can start work immediately. This is an example of how we as doctors, we as a union, working together with the other arms of government, can actually make things work.
And you think this is not possible without healthcare providers being at work? You would not have that audience unless you downed your tools?
Previously, no, we wouldn't have that audience. But now we are beginning to have that audience. If it were not for the strikes, I wouldn't be here today. You would assume that everything is okay, but it's not. So it gives us the audience with the relevant people, with the relevant authorities, to discuss and actually put things into perspective.
At the cost of Kenyan lives?
Unfortunately, so. But while some are on strike, there are others who continue giving the services. There's a referral network around, so patients and clients can still get healthcare services.
That's a little difficult because mostly these people who come to public facilities cannot afford a private one. So it is basically a kind of sentence to continue in their suffering if they cannot make up the fees to go to a private facility.
The referral facilities are not only from public to private. In the public sector, you have 6 tiers of facilities. So if tier 5, for example, which are mostly affected because that's where the bulk of the doctors are, tier 4, 3, 2, 1 are still functional.
So what you're saying is that you're prepared to stay on with this strike at whatever cost?
No. We want to get a solution to the strikes at the soonest possible because we want healthcare service delivery to continue.
If it takes another month, so be it.
We are determined to have it solved as soon as possible, not a month.
And what are you doing to get to that end?
So far, I'll give you an example of Nakuru County. They have sat down, they have discussed what the issues are and have reached an agreement of how to have things in perspective and how to have things solved so that services can resume. So out of the 47, as you said, there are only 8 counties which are having problems, and these are, as we speak, in being solved.
And in the long run, what is the permanent solution so that if we could just focus on the Kenyans who are unwell and need your services, what is the long-term solution for them?
The long-term solution for me would be, let's look at what we've done with the interns. We formed an intergovernmental body as such, from the national to the county governments, with the input of the doctors to actually manage the human resource, which is the interns. If this can similarly be transferred to the general healthcare workers, the doctors and the nurses, then we would have a solution by working together. But when one arm throws blame to the other, the national government blames the county governments blame the national government.
Then you'll pass the back to the patient?
No.
Well, that's what you're doing by being on strike. I thank you for coming to studio. We'll take a short break. On that note, you think about what you've heard, and we'll be back with more news after this.